Hi, I'm Dr. Jamie Kondis, and I'm here to talk to you about cold weather injuries. Children are at greater risk for things like frostbite and hypothermia than adults because their smaller bodies allow them to get colder more quickly, and also sometimes kids are playing outside and don't want to come in even though they're starting to get too cold. One of the things we worry about is frostbite. And frostbite generally occurs on places like the fingers, the toes, the nose, and kind of things at the end of the body. With frostbite, the affected extremities can get very red and tingly and painful, and then they can actually get gray or white and numb and can even develop blisters. If you're concerned that your child might have frostbite, bring them into the house, soak the affected extremity in warm, not hot, water. Don't try to pop any blisters. Soak them sometimes for up to 20 to 30 minutes. But if your child is complaining of pain or numbness and those symptoms don't go away after a few minutes, then call your doctor or come to the emergency department because they may require further care. Another thing we worry about is hypothermia. And hypothermia, or the body temperature getting too low, is actually a medical emergency. If your child starts feeling too cold, they may start by shivering, but then they actually may develop symptoms like clumsiness, confusion, or lethargy. If they're developing any of those symptoms after being out in the cold, just call 911 or bring them to the ER. What can you do in the meantime? Remove any wet clothing, because wet clothing actually helps heat escape even quicker, and wrap them up in blankets. So how do we prevent cold-related illnesses like frostbite and hypothermia? One thing is monitoring how long your children are out in the cold. And if the temperature gets really low, for example, a wind chill of -15 or lower, just don't even let your kids outside in that weather at all. But if they're playing outside in cold weather, it's best to dress them in layers, so multiple layers of clothing. That way, if the top layer gets wet, you can remove that, put on another layer. And then also just having them come inside and warm up frequently. Always make sure that they have on mittens, boots, thick socks, because again, those end of the extremities are the most likely to get frostbitten. Scarves, hats, even covering the nose if you can, but really just having them come in frequently and monitoring them when the weather is cold. It's great to have kids playing outside year-round, even when it's cold, but make sure they're not getting too cold.